Hello, everyone. Welcome. Good afternoon. My name is John Bonura. I am a policy analyst here at the Texas Public Policy Foundation, and thank you for joining us today as we discuss homelessness policy. The current state of homelessness is reflective of an overall policy failure. Decisions at the federal level have corrupted the goodwill of taxpayer and the original mission of government involvement in the homeless space. Nationally, the homeless population is at an all-time high, and here in Texas, the homelessness has increased every year for the last decade. After all you have to do is look outside to see that there is a problem. Cities all across Texas have businesses that have banded together to employ private security guards to protect their property, and in some cases, even public safety. What's even more troubling is what is happening outside the city center. Homeless encampments in Greenbelt areas here in our state's capital are not only hotbeds of drug use, violence, and human trafficking, but threaten public health and safety with the waste they generate, as well as unintended campfires that have gotten out of control. And only too recently have we seen how dangerous this can be in drought-prone areas. The increase in homelessness is due in large part to guidelines at the federal level, which changed the focus from promoting self-sufficiency and individual trauma-based care to low-barrier housing, prohibiting programs that require commitment to job training, mental health therapy, or drug treatment from receiving grants. Other factors that have contributed to this include a lack of real-time data sharing between nonprofits, law enforcement, and outreach teams, a continuum of care system that is left largely unaccountable, and local government entities that refuse to enforce laws like public camping bans. Now, to correct this, the Trump administration issued an executive order entitled Ending Crime and Disorder on America's Streets, putting homeless policy on a path that focuses on safety, accountability, and demands results from homeless individuals and nonprofits. There is an analysis available, which I authored, that can be picked up at the front, or you guys can read at texaspolicy.com. The idea is not to treat homeless individuals as criminals, because there, but for the grace of God, go we, but to reach those who have the capacity to be reached and help them remove themselves from that cycle of homelessness. Today, this panel of experts in the sphere of homeless policy, moderated by my colleague, Jose Melendez, director of the Taxpayer Protection Project here at TPPF, will discuss what homelessness looks like today, how we arrived at this point, and what the future of homelessness may look like. We're also joined by David Gray and other officials from the Homeless Strategy Office here in the city of Austin. And I would like you all to you'll pay nice and close attention while we have this illuminating discussion on homeless policy and how it affects Texas. Thank you.
Well, thank you, John, and thank you, guests in the audience and guests online on the live stream for joining us today for an important discussion on homelessness in Texas. So this issue has grown steadily worse over the last 8 years, and one of the strategies proposed, Housing First, seemingly doesn't work. It doesn't deliver the long-term outcomes that we desperately need in the homelessness space. And at the same time, we have an executive order that, wants to look at treatment and wants to look at accountability. And so today we're going to explore how this is going to help the state of Texas as we tackle homelessness. And I have a panel that has a wealth of knowledge on the issue. And so I would love for you to just allow me a moment to introduce them. Lisa Hugman. So Lisa is the co-founder of Family Bridge and serves as homelessness solution strategist. Hugman is a dedicated community advocate with extensive experience in Austin's homelessness response ecosystem, specializing in strategic coalition building and cross-sector collaboration. She actively engages with the state and local government, leading to significant policy breakthroughs, including previous collaboration with the Texas Governor's Office that resulted in $55 million in state funding for Austin's homelessness services. She is a graduate of the University of Maryland with a bachelor's degree in science and in business and finance. Next, we have the Honorable T.N. Parker, Texas Senator for District 12. Previously serving in the Texas House, Parker held leading committee roles on policy matters vital to our state. His legislative accomplishments represent his extensive work fostering Texas economic vitality and protecting our most vulnerable. The bedrock of his service is exemplified through passionate advocacy for community and fighting for common sense conservative principles that strengthen Texas prosperity. Senator Parker graduated from the University of Dallas and earned a master's degree from the London School of Economics before building a distinguished private sector career in technology and private equity. Ashley Quinones. So Ashley serves as the U.S. Department of Housing and Urban Development Southwest Regional Administrator, serving Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. So Mrs. Quinones was appointed by President Donald J. Trump during his second term in 2025. And as a regional administrator, Ms. Quinones oversees field operations across the region to further HUD's mission and advance Cabinet Secretary Scott Turner's priorities focused on ensuring everyone has the opportunity to achieve the American dream. Prior to joining HUD, she served numerous communities throughout Texas in the healthcare sector, where she was responsible for implementing legislative and public policy strategies, leading efforts in strategic planning, business development, outreach, and community engagement on behalf of large healthcare organizations. Ms. Quinones is a fifth-generation Texan, magna cum laude graduate from Texas A&M University, where she earned a Bachelor's of Science degree in political science. And finally, Mr. Paul Webster. So Paul is a senior fellow for the Cicero Institute and is an expert in all things homelessness, including all programs and policies. At the Cicero Institute, his research is focused on developing model legislation, effective public policy, and providing testimony in support of these efforts. He brings more than 30 years of experience to this work, including roles as executive director of LA Alliance for Human Rights and senior policy advisor on homelessness for the U.S. Department of Housing and Urban Development. Webster received his MPA in Public Policy and Administration from the University of Southern California and his bachelor's degree in Communications from California State University and Long Beach. So, as we get started, I do want to talk a little bit about your efforts. So every person on the stage has tackled the issue of homelessness, whether it's in government, on the ground, in policy. What's the biggest factor in play right now in the homelessness space? And so, Lisa, I'd like to kick it off to you.
Sure. There are so many issues in play, and so I picked the one that affects me the most, and I didn't think the other panelists would mention. That is the prioritization scale in the intake process. Oh, that's a bunch of words. And basically, when a homeless person, we would call them a client, comes forward and asks for help, they are evaluated by a caseworker, and they are given a priority number. What we have in the way of policy is the chronic homeless who are the most in need receive the housing help, as opposed to trying to carve off the newly homeless or the prevention, which would cost less and reduce our numbers faster. This creates a lot of problems. First, we have the situation where the chronic homeless are, in effect, incentivized to stay homeless as they need to be in that state to receive the housing that they've been promised. Once they're in that housing, they are the least likely to have a successful outcome because of their adverse situation. They're also the least likely to engage in services that are offered to them. We hear a lot about services. Unfortunately, when that housing term is up for that homeless person, that housed person, we have a very high rate in Travis County of those folks returning to unsheltered living in an encampment. Okay, so let's look at the other end, which are the newly homeless. You know, in Travis County right now, the highest demographic of homeless is families, and they're pouring in at a high rate every month. The numbers are increasing monthly. So these folks that are not, they're not addicted to drugs, they're not suffering from mental illness, they're the ones that really could use the help. With Family Bridge, these are the clients I have. I can give you an example. Adrian is a single mom with 2 young kids. She fled from an abusive marriage in Florida and came to Texas and ended up car camping in the Walmart parking lot in Sunset Valley when I found her, and she came under my care. I tried to find help for her, but she's overqualified. She has a car. She had a part-time job working DoorDash. She wasn't on drugs, no mental illness, and she had some college under her belt. She's a great mom. And so philanthropic dollars are what helped provide the prevention into homeless for this individual, and then we reunified her with her parents back home in Miami using one of our local reunification services out at the Other Ones Foundation. So that's a real problem in that prioritization scale.
Excellent. Senator Parker, what's the most important factor right now in the homelessness space?
Well, first of all, it's great to be with all of you. It's great to be with our friends here at TPPF. Thank you all for sponsoring this and putting it all together and your leadership on the issue. And it's great to be with so many friends here in the audience as well. So I want to tell you how much I appreciate you caring about this issue. I guess it is now. So I just want to thank you all for being here, and very grateful to TPPF and all of the wonderful friends in the room that care about this issue. Listen, it's hard for me to narrow it down just to one particular thing. I think there's so many things to talk about. I'll try to be brief. But, fundamentally, as was said in the opening, federal government policy for many, many decades has failed this country when it comes to the homelessness issue, period, end of story. And so how do we solve it? Well, I think first and foremost, we've taken this historically, this command and control structure coming from D.C. down to the states. And we're really turning that upside down with the president's executive order and allowing the states to drive. For those of you that know me in this room, I'm very passionate about federalism. I believe the 10th Amendment is real and needs to be utilized at every turn, and that the states drive real innovation and real breakthroughs in every area of human endeavor. And when the states compete, the American people win. That's what the Founding Fathers envisioned. That's what it needs to be. And the states drive the agenda, not a broken capital in D.C. historically before this new session of Congress and the new administration here in January. So what I would tell you is, because of those failed policies, you see all this byproduct, if you will, of bad, catastrophic decision-making over decades. And so when you see the fact that this problem is growing, it is growing by leaps and bounds. So the first thing I look at as a legislator is, okay, first and foremost, as a person of faith, this is absolutely unacceptable to me that men and women that are created in God's image and likeness are allowed to suffer on the streets in their feces, and we don't give a damn about it, that we allow them their constitutional liberties to be able to sit there and die. It's nonsense. And so that's the first thing to me that is just absolutely egregious about the whole process that needs to be addressed. And so it's been an honor for me to start tackling these issues the last couple of years in Texas. So many of you in this room have been part of some of those roundtables I've been very fortunate to put together with 100 or more stakeholders from all the cities, all the leadership in those communities on these issues, the nonprofits, the charities, all that are serving, trying to find common ground. You know, I'm blessed to be the Republican leader of the Senate. I can drive any policy I want to drive down. But if I don't have broad buy-in, I'm going to be very candid, if only 51 or 52% of the folks agree with what I'm doing, it's going to be failed. It's not going to be implemented with fidelity or the vision that we have. So I try to bring together every stakeholder I possibly can to find common ground on these very important issues. But when you look at what's taking place, we've got to be able to address the issue where first responders on the streets here in Austin, Texas, can go and take someone off the street that is having challenges, that is not able to make a good decision for themselves. We had to alter in my legislative proposals that have passed the Senate, but not yet the House. But I can assure you they will pass next time around. But what I'll tell you is we had to change that process ever so slightly to allow a first responder to take that individual to get the help they needed. Not to a jail, not to an ER, but to go to a specialized triage center that enables folks to get care and treatment. If they need acute mental health services, they'll get them at that point. If they don't and they're able to be on their own without that support, guess what? As opposed to giving them a kick out the door, we're going to give them a warm hand and give them an extension to an agency or a great nonprofit that can help them get back to self-sufficiency, to learn some job skills, to get employed, to get healthy again. All those things that need to be done in order to be successful. So all of these, to me, are the core elements that need to be addressed more intelligently, along with, frankly, finding a centralized services model for the major counties in this state and, frankly, for the country. I believe in centralized services. The San Antonio Haven for Hope model, I think, is optimal. You bring together thousands of great nonprofits, all the agencies, into a centralized location where everyone in that community knows they can go and volunteer, they can go and be philanthropic and donate, they can get help for people that they love or know that need help, and certainly that those first responders know where to take individuals. So those are the key items for me about how you address this solution going forward, along with addressing fundamentally the issues, the stigma around mental health. I think we've done a heck of a job, to be very candid, the last 10, 12 years of making real gains in this regard. People are understanding that if you're dealing with a mental health challenge, it's no different than a broken leg or a broken arm or some physical ailment. It is a part of your body that is not functioning well. And as conservatives, we need to embrace that. We need to accelerate the intelligent use of it. We need the states to drive the agenda. We can't do it alone. We need the private sector. Government cannot do it alone. It should not ever do it alone. I believe in a limited government. I believe in free enterprise and free market. But there are ways in which we can work together to partner to address these issues, and I'm delighted with the President's executive order and the fact that it aligns so beautifully with the framework that I've been blessed to be a part of carrying here in Texas. So with that, I look forward to the dialogue, and thank you again to everybody here at TPPF and all our friends in the room for being a part of this dialogue today. It's so important.
Thank you, Senator Parker. Well put. Ashley, what's the most important factor right now in the state of play for homelessness?
Thank you all again for the opportunity. Am I good? Okay. As he mentioned, Ashley Quinones with the U.S. Department of Housing and Urban Development, and I have followed TPPF's work for many years, was first introduced to the organization by my former boss, U.S. Senator Phil Gramm, when now Secretary Rollins was leading the organization. So just kind of a full circle moment for me to be able to join you all today and really talk about such a critical issue. I'm going to kind of piggyback on what the senator said in terms of that holistic approach. And you see it within the president's executive order, that holistic approach coming through. My background, again, 15 years as a healthcare executive throughout the state of Texas. And, you know, when you see folks come into your emergency department that are using your emergency department as their primary care, you realize that they have other issues that aren't being addressed. It's not just a healthcare access issue. It's often, you know, in conversation with that patient, you learn that they have a housing issue. They have, you know, a food insecurity issue. They have a litany of issues. And so the Secretary Scott Turner, very intentional about the appointees within HUD, not only coming into HUD with a housing background. And so that's how I ended up in my role. And so now, being within HUD, when I'm looking at the issue of homelessness, I see a healthcare issue. I mean, we are treating the same population, if you will, whether it be in a public hospital district here in Austin, Texas, whether it be in a private health system in Austin, Texas, whether it be, you know, dealing again with individuals that are homeless on the streets of Austin, Texas, or, you know, list any city within the state. The overlap, the synergy between, again, in my regard, you know, in my respect, healthcare and homelessness, you know, just incredible synergy there. And so that holistic approach is what I would say is what, you know, we are focused on at HUD. Yes, you can shelter someone, but if they have a root cause, again, of mental illness, I think the last statistic I saw for the state of Texas, our homeless population, 30% identify as having a severe mental illness or substance abuse issue. So again, it goes back to your point, Senator, of yes, you can house an individual, but are you truly helping that individual in terms of getting on a path to self-sufficiency so they can reach their God-given potential? So I would highlight the holistic approach.
Excellent. Paul?
The single greatest factor affecting homelessness over the last, I would say, 20 years is the federal government's policy that put the prioritization of addressing homelessness on providing government subsidized leases instead of addressing the root causes for why people are unable to access treatment, why they're driven out into the streets, why they exchange the destitution of the streets the security of a home for the destitution of the streets. I think in 2009, when Congress passed the Hearth Act and changed the way that communities were funded to address homeless assistance and put in place this continuum of care regime and really significantly regulated what federal dollars could do at the local level outside of the authority of municipalities, outside of the authority of states, and essentially minimizing the impacts of serious mental illness, powerful agents on the street that are ubiquitous, that are dirt cheap, that are highly addictive, and that are susceptible to creating psychosis, and also the idea that the lack of accountability to organizations that are acting in the stead of the government and failing to deliver on outcomes. I think another factor that happened in 2009 and 2013 when HUD finalized the interim rule on the Continuum of Care program was, what was the objective? Now, most of us in this room, when we talk about homelessness and we think of, well, what is the objective? We think, well, the objective is that this person is no longer homeless, that they're actually not dependent on government subsidies, that they are living a healthy life, that they're reunified with their families and their children, and that they're not committing crimes and they're not impacting the surrounding communities with respect to all the things that John was talking about, assaults, public psychosis, fires, whether it's a fire to keep you warm or a fire that gets out of hand because you're cooking something that you shouldn't be cooking. So when we fail to take those impacts and we have no outcomes and we have no accountability, you get what you have now. Instead, what HUD designed and what was promoted by the homeless advocates was this notion, and it's right on the website of the National Alliance to End Homelessness. They say it: we know how to end homelessness, and it's housing. I just want to see a show of hands of anybody in the room who has a monthly expense that is greater than their housing expense right now. No hands. What this means to me is that the federal government, in its wisdom, has decided to subsidize and provide the most number one expense to people who have very, very limited ability to earn income, and we think that we can actually scale that to solve underlying problems that are not that don't have anything to do with their ability to enter into a lease contract and pay the rent. So I think that the federal control, the federal regulation, we have no understanding of how to move the needle. I ask city council members, I ask state legislators all the time, I say, is homeless going up, going down, or staying the same? Most of them don't have a clue, except for what they see and the rejection of the destitution and the civil disorder that they see on the streets. So I'm a big data nerd, and I say, look, if you can't measure what your programs are doing, you have no idea what impacts you're making. So in addition to what the single most factor is on homelessness with respect to how we got here, it's the federal government. With the single biggest factor in terms of homelessness of where we're going forward, it's President Trump's leadership on this executive order. This executive order and the reforms that HUD is making with respect to the COC program and its notice of funding opportunity are game changers. And we need to take advantage, states need to take advantage to implement the provisions of the executive order so they apply to what's going on in the states. The federal government needs to take advantage in terms of agencies such as the Department of Justice, Department of Health and Human Services, obviously HUD, even the Department of Transportation is named in the executive order, to implement this so we can start changing the game and actually using outcomes to measure impacts and deliver results. And the results should be fewer people that are living and dying on the streets, fewer people going untreated for chronic conditions, including serious mental illness and chronic substance abuse disorder, increased quality of life, and greater public safety for the places that are significantly impacted by homelessness.
Excellent. I'd love to do some more directed deep dives and get to know you guys a little bit better. So Senator Parker, let's start with you. In recent legislative sessions, you've been the absolute champion when it comes to homelessness policy. And you kind of touched this a little bit in your opening remarks, but you worked on legislation this past legislative session. I'd love for you to talk to us about or walk us through those legislative measures and tell us how those measures would have impacted the state of Texas.
Well, look, I'm just so blessed to be here with this panel with these incredible experts here that are living it, working it 24/7. Listen, first of all, I just got to make one comment before I answer that question. I thought that your assessment is spot on about the lack of data. And for those of you that were a part of the roundtables I was blessed to put together in 2024 with stakeholders across Texas, we hammered on the lack of data. I'm a business guy. I do venture capital, private equity work in order to provide for my family and be a lawmaker all these years voluntarily, effectively. And what I will tell you is that I was so frustrated, as I often am in different areas of government, to see that we had so little data, so little information that was worth a darn, that was timely, that was up to date. And I knew how many beds I had available in a particular city, or I had, how many folks tonight are at risk, or where are we? We just have, in my mind, very little access to that kind of data. And a lot of that, of course, is old federal government siloed technology that is broken and needs to be updated and upgraded in a 2025 world. And I know that with Ashley and our wonderful secretary, I call him Scotty T, with all due respect. He's my dear friend I love and worked with for many years in the Texas House. Secretary Turner understands this dynamic, as does the president, and the importance of addressing it. So with that being said, let me answer your question. I would tell you that in terms of what we tried to accomplish, again, I wanted to bring together all the stakeholders in Texas to address the issue. I don't pretend as a lawmaker to have the answers to every topic under the sun, whether or not I'm driving capital markets for Texas and the stock exchange, or whether or not I'm blessed to drive homeland security or cyber, or here talking about homelessness. I try to surround myself with the best, the greatest minds on the topic, and to really learn from them and to try to find common ground. So that's the first place I try to start. Then what I try to accomplish from there is to understand, okay, what are the distinctly powerful things that we need to do? The legislation that I was blessed to file and pass out of the Texas Senate did a handful of things. So I'm going to kind of lay them out in some detail and what they would have meant for Texas. First and foremost, the ability to change the commit process, as I said earlier, ever so slightly, would have enabled us to take men and women created in God's image and likeness on the streets in Austin or Dallas or Houston or any other big city in this state, and been able to go have a first responder take them to a local triage facility to get real health care benefit. Not to a jail, not to an ER, but to a specific facility that would give them the ability to understand what is their current condition. Are they mentally stable or not? Do they need acute services or not? That kind of fundamental thing at the very beginning of the process has to happen. And so if you go to this kind of very simple, what I refer to like a clearinghouse, so to speak, to go and to get a treatment and attention to know whether or not someone needs help or not. That's the first piece of the process. And you got to be able to, like I said earlier, modify ever so slightly that commit process to get folks to be reviewed by a physician. All right, that's the first step. And that's what my bill would have done. I think if that bill had been implemented, that element alone, we'd be addressing this problem all across the state. And so, yes, I care as a person of faith, as do all of you in this room, about the human being. But then I also care about the public safety of 31 million Texans that every day deserve the right to be in their downtowns in Fort Worth and Austin and Dallas and enjoy it without worrying about some issue, something that's happening, something that puts them and their family at risk. I want our families that are over here closer to the beautiful geography here, I say topography, of Western Austin, to be able to come and enjoy downtown Austin again. They're afraid. They don't come here on Congress Avenue anymore. How sad is that? Because of the homeless problem has become so bad. It's also affecting our business community, okay? Look, let's be real. The only way we can afford any type of assistance for people that need help through our Health and Human Services, the only way we can fund education, fund water, fund roads, is an economy that is growing at a faster rate than any other state in the country. We're the 8th largest economy in the world. Our modeling projects that we'll be number 7 before year end. That means larger than France when we jump to number 7, larger than Russia, larger than Canada. And so we have to address all of these issues intelligently to protect our business community. It's what drives all of the blessings that we have in this state. It's job creators, entrepreneurs, the DNA that makes Texas, Texas. And so we've got to protect that as well. We can't become San Francisco. San Francisco has been such a disaster the last couple of years. All of those downtown businesses have absolutely just died. They're gone. And they're trying to figure out how to recover. Well, I don't want to see our Texas ever be in that situation. So what I'm talking about in terms of this process, getting people off the street, clearing house, getting a medical assessment faster for more people would make an enormous difference in getting people off the street. And as I said earlier, if they have a real problem, they're going to be able to get the services, the medical services they need intensely. And if they don't, and they can live on their own and be self-sufficient, as opposed to, again, just a good kick out the door, is what we've done over the years, we're going to give them a hand and really make certain that we carry them from that experience to the next place that can help them when they're in such a desperate situation. With regard to housing, yes, appropriately, but health care, to learn a skill so they can be providing for themselves and their families again, and to get healthy. So all of those elements, along with this centralized services model, is what I'm advocating for. I want every big county in Texas to have 2 of these facilities. I'm not trying to turn upside down the apple cart with regard to all the great work of all the ministries that are happening in all these cities today. That's fabulous. I applaud it. I think it's great what they're doing in all these big cities and working with the local agencies, the cities. It's great. Leave it alone. But what I'm saying is this problem is not shrinking. It is growing. And it is growing by leaps and bounds, largely because of the mental health issues that are very acute and that are growing. We could talk about the root cause of those another time. But what I want to see us do is tackle those issues and do so in a centralized services model so we address the future. So that future folks that are dealing with homelessness, future donors, future volunteers will all know whether or not they're in Bexar County or in Travis County or Dallas County or Tarrant County, they will know where to go to get help. And that's why I think the centralized services model is so important. That's why I advocate for it. So all of these things are part of my legislation that passed the Senate, that died in the House. We'll make certain that we get it done next time around. But it really, like I said, I can't say enough about President Trump's leadership on this issue and Secretary Turner understanding this. What they're doing, this executive order, really resembles greatly the framework that I've been blessed to be a part of with so many of you in this room, that we will work to make the law of the land in America, where the states drive the agenda and the solution. Not a broken D.C. from a centralized command and control perspective, but the states where we know what's really happening best.
Ashley, so you work at HUD and you were appointed by Secretary Turner, a great Texan and a friend of the foundation. He's talked about, and you mentioned earlier, a holistic approach to homelessness, to addressing that problem. Can you take a moment to just paint a picture for us? What does that look like?
Most definitely. So at the center of that picture is the person. And again, the senator touched on it. We've all touched on it on this panel. And when I say truly at the center of that picture is the person. And if you know Secretary Turner, I'm not going to call him Scotty T, but if you know Secretary Turner, you know his heart is for people. In his entire career, whether it be from his time in the NFL, now as HUD Secretary, has been focused on finding opportunities to come around people and lift them up and out of their circumstances if those circumstances aren't good. And so truly at the center of that picture is the person. And I'll take it even a step further in terms of how personal this is to Secretary Turner as someone who had an uncle in his own family who found himself homeless. And once family realized that that is the state that the uncle was in, they came around, of course, as a family and wrapped their arms around him and got him the help that he needed. So you cannot get more personal than literally putting the person at the center of that picture. And so you put the person at the center of the picture, and then around that, you touched on it, are those organizations today that are doing the Lord's work day in and day out to address the various issues that that individual may be tackling on a daily basis. I would say then kind of the next ring of that in terms of how HUD comes into play in one way is the incentives. I mean, today incentives in the federal government are completely misaligned. You fill in the industry that the government is involved in, and the incentives that the federal government has put in place are misaligned. I'll speak to healthcare again. You know, the incentives are not necessarily aligned to keep that individual healthy. Same in regards to, housing. Same in regards to, various incentives at the federal level within the U.S. Department of Housing and Urban Development where, how can we better incentivize more private entities to get involved to support individuals that are struggling with homelessness? How can we incentivize someone to get on a path to self-sufficiency, to get that education, to get that training, to get a job, not worrying I may then lose the house that I do have today if I actually get a job or I get the next highest level paying job. So I would say, secondarily or third in that painting the picture is the incentive piece of, us within HUD working again, with the president, working with our other partners, looking to how can we better incentivize and align those incentives. And then lastly in that picture is really breaking down the silos. And again, I spoke to this earlier about the secretary being very intentional for those that are on his team, not only having housing backgrounds. I think that lends itself to those silos. And so we're working with, all of our partner agencies at the federal level to have that open line of communication, whether it be the Department of Justice, whether it be, Health and Human Services, whether it be the Veterans Affairs organization or administration. That the other part of that picture is really working hand in hand with our other federal partners to really create a system that truly works for the individual, again, that's at the center of that picture.
Paul, for years you've done excellent work on homelessness at the Cicero Institute, and you recently released new research touching on federal reforms. Can you talk to us a little bit about those reforms and how that may align with the current Trump administration and HUD?
Sure. Thank you so much. So when you look at public policy that is addressing homelessness, I think one of the challenges is that, and I appreciate your affection for data, Senator Parker, because you and I, we can nerd out together. But when you don't know what you're measuring, you're never going to know what you're going to get. In other words, what you measure, you get. And really this is an issue of numerators and denominators. Remember that? I think I learned this, I think I was in 5th grade, what the numerator and denominator is. So remember, the denominator is your universe. How many people are in this room, right? And the numerator is how many of those people are left-handed, right? So we don't do that when it comes to homelessness. When it comes to homelessness, we create this broad brush that says everybody has the same problem and the government is the answer with the provision of subsidized housing. And so what we're trying to do, and one of the things that I've done recently is I've looked at the analysis, the assessment, the audits, if you will, from 5 different jurisdictions, the state of Washington, the state of California, the city of Los Angeles, the state of Arizona, and the state of Louisiana, looking at the continuum of care in New Orleans. And those studies, those analyses, were very revealing because they hit on a number of issues that were very common. Financial oversight, lacking. What does that mean? That means you're not getting what you pay for, right? Data gaps. What does that mean? Means we're not measuring things consistently, and therefore we can't make decisions, neither can we report whether things are going up, down, or staying the same. Service delivery problems, empty beds when people are on the street, double, triple counting individuals and paying for the services for the same individual more than one time. We also saw significant challenges in terms of just general accountability. And I do a lot of work in Los Angeles. Los Angeles, if just to, I appreciate you don't want to be like San Francisco. San Francisco is actually starting to get better. Don't be like Los Angeles. But here's the challenge. It's not a bad criticism. But so during in Los Angeles, as my work with the LA Alliance, we sued the city and the county of Los Angeles because of their poor policies and results with respect to homelessness. As part of the jurisprudence, as part of going through our arguments with the court, we asked the court if we could hire some kind of an audit, and we were able to do that. And it was really great because we got a great audit firm, Alvarez and Marcel, who's a global consulting company. It's not just some guy with a pencil and a pad of paper from LA who happened to know the right people, right? You know what I'm talking about. So they did an analysis of what was going on in the city of Los Angeles, and here's what they said. They said, it's like a bowl of spaghetti. You cannot follow one strand of spaghetti to get to an actual outcome. So the challenge then is how do we translate that into public policy? How do we increase accountability? How do we make sure that outcomes are true outcomes? How do we make sure that the intervention isn't causing negative externalities, such as increased costs for fire department responses to homeless encampments? How do we make sure these negative externalities aren't showing up in the emergency rooms? So one of the things in the executive order, and I love your idea about these one-stop, places to go, the executive order makes provision for that with this certified community behavioral health clinic promotion. The Congress has actually done a wonderful thing to provide to states to say, look, we have this model. It's a cost-effective, very effective model, particularly with respect to reducing jail time and recidivism, reducing emergency department visits, and reducing homelessness in general by making sure that people are integrating, people have access to treatment for serious mental illness, treatment for substance use disorder, 24/7 crisis management, and those kinds of things. When they're integrated with housing and the ability of communities to actually respond to the issue on the street. Here's the other great thing about data. When you understand how many people in the room out of X number of people are left-handed, do you know what you can do? You can make decisions like saying, how many left-handed desks do we need? When you treat everybody the same, you can't make any kind of decisions, and you can't make any distinctions about the number of people that need intensive substance use disorder treatment, the number of people who need employment services, the number of people who are trying to escape drug addiction and into recovery so that you don't put them back into housing with active addicts and dealers. That's the power of data to help you make decisions. So what we're trying to do at Cicero Institute is we're trying to say, look, how do we match up the public policy with what we know from data analysis, from programmatic analysis, from what we're seeing around the country that either isn't working or is working, and then how do we capitalize on that? So we feel like this is the time for opportunity. We got to make hay while the sun's shining. The federal government needs to implement the executive order in a substantive way. States need to implement the executive order in a substantive way, and we're excited to be a part of that process.
Excellent. So before we head into Q&A, I'd like to give a final question to Lisa here. So Lisa, you're a force of nature. You have firsthand experience in the homelessness space. Talk to us about what you're seeing on the ground, and what are some of the solutions we need locally to address the problem?
Sure. I'm going to touch on two things that are positive that we're seeing. Seeing a bigger focus on prevention and diversion. So federal money has strings attached. You can only spend it a certain way. Philanthropy allows homeless service providers to become innovative in their solutions. A year ago, Sunrise Navigation, you've probably heard of them here in Austin, put together the Wayfinder program to address the growing number of homeless families and newly homeless people coming into their system. They raised the money, and now when a family that has recently been evicted or is facing eviction, they need help and they need it fast. They can go to this organization, Wayfinder, and instead of being told, put your name on the list and wait, they are told, go find an apartment and we will help pay your move-in costs. The cost differential is about $800 one time for move-in costs versus $30,000 a year for supportive housing. Okay, so they're having great success in empowering a family that's having a hard time to go from dependency to self-sufficiency. Second, seeing great things in workforce training. We have today with us Chris and Liz Baker, and the experience out at Esperanza is Esperanza, in case you don't know about it, is a tiny home community for formerly homeless people, and the Other One's Foundation runs it, and this couple is the Other One's Foundation. And what they do is they build community similar to what Alan Graham is doing at Community First in that regard. But recently, ACC has built a small campus on the property at Esperanza, and they are offering workforce training for plumbing, welding, auto mechanics. And as Chris and Liz have seen the past few years, as they empower a broken spirit by giving them community, sobriety, and workforce training, they see a glimmer of hope in that person. They regain their dignity. They can see themselves as a success in the future because they're learning a trade and they know they will be able to provide for themselves in the outside world. I think Esperanza would be a great model to repeat throughout the state. So did you ask me also what we can do locally? So locally, advocacy, usually advocates are paid. And when you're paid by somebody, you are beholden to the philosophy of whoever's paying you. So advocacy is a funny thing. I'm an advocate. TPPF likes to call me an advocate. I like to bridge the state with the city. I like to collaborate and galvanize and get ideas sharing and talk about how to solve solutions. I don't get paid by anybody, and so I do it on my own. But if you are the type of person that likes that, then jump in. And now's a great time because we are with an administration that's encouraging this movement. And so that's what I would say locally.
Thank you, Lisa. So I'd like to turn it over to Q&A. One thing that I'll say is please make sure that we get an actual question and not a statement. You have mics on your left and right, so please raise your hands if you have a question. Lady up front.
Good afternoon. My name is Perla Hopkins. Thank you all for being here. As a woman veteran, one of the most emotional and hardest thing is to see fellow veterans, especially here in the greater Austin area. And so I often pass out like some housing and veteran crises cards that I have, or if I have some cash, I trust that they are a military veteran that is suffering. And my question is, what federal collaboration do we have to close gaps? For example, I don't qualify for VA medical benefits. I'm often dropped, although I'm invited to appointments. I'm later billed for them because I'm also married to a veteran, and he happens to earn more than $62,000. And so that is the threshold where I'm not, I'm limited, and so I don't receive those benefits. So I have to imagine that that sort of thing is going on when it comes to our homeless veterans, and so that's very important. Also, speaking about local outreach, Senator, I have 3 Longhorns here in Austin, and so I'm very involved. I'm part of a parent watchdog group, and one of the issues that we have is some of the local churches inviting the unhoused individuals because they want to feed them and whatnot. But you can about imagine the security, implications that causes. So thank you all again for continuing to just work on this very important issue, and I thank President Trump because I know how important not just military veterans are, but solving all the crises in our country.
Well, first of all, thank you for your service to the country. We're very grateful to you, and thank you for bringing the question forward. I would say one of the roles I serve in today, I've been the Vice Chairman of Veterans Affairs in the Senate. I'm now the Acting Chair of Veterans Affairs at the moment, and look, there's nothing more important to me than taking care of our vets broadly across the board. Texas, we have more veterans in Texas than any other state in the country. That's an incredible honor for us, and we need to take care of our vets second to none. There's no question in my mind that there is an opportunity now, given the light that has come to DC with President Trump and Republican majority, that we can do a whole lot more with regard to breaking down these silos of horrible policies that have hurt us from being able to help veterans. It's really like Lisa talked about earlier. The similarities are glaring to me, that she talked about a situation with a woman needing help living in her car, but she had a car and she had a job door dashing and had limited means, just like you're talking about limited means for yourself and your family, and yet then you're therefore blocked from getting access to something that gives you the ability to be self-sustaining. This kind of mindset has to change. We do the same thing with regard to not promoting marriage, for God's sake, in this country historically. And people would prefer, because it's financially better, because the federal government has incentivized them to stay single versus getting married. It's the craziest thing in the world. The family is the fundamental building block of society, period, end of story. And we've got to have all of our policies in alignment with that. And just like you described here, we've got to make certain that we're aligning with the needs of veterans that need help. So we'll look further into all of that specifically, and if there's some specific program or gap or something that you're not applying for and getting access to, let us know, and we can work obviously with Ashley and our friends at HUD and our friends at the VA and the Texas Veterans Commission to make certain that we're getting the services that people need. But bottom line, just reach out to me. And your final comment with regard to safety for our kids. You got our kids that are students here at UT, and we appreciate all the churches and ministries taking people in, but when they're taking the homeless in, at the same time they want to help the youth, there is, without question, we need to be honest about this. There is definitely a security threat to our kids. A lot of the folks that are homeless, through no fault of their own, are mentally ill and unstable. And so we need to just recognize it's a security threat. And so this is where it becomes more complex, and it's why I believe in centralized services, to come back to my theme, if you will, of the conversation here today.
Ashley.
Yeah, I would just add that we are having those conversations at the federal level, secretary to secretary directly between HUD and our Veterans Administration. And so feedback like yours, we don't know what we don't know. So feedback like yours is critical, and that's one of the key parts of my role is, when I'm in the community and I'm learning about best practices, great models, horrible models, feedback from individuals, individual constituencies, whatever it may be. That's part of my role, is to share that with the secretary, because we are having those conversations again at the highest levels to see where those gaps are. And if that gap hasn't been identified to us, we don't know about it. So we'd be happy to continue a conversation with you and share that information with our leadership.
Questions?
Hello there. My name is Christina Snyder, and I had a question regarding the current laws that exist in order to enforce penalties for public loitering or setting up tents in parks, and just endangering families and children that are near these homeless communities. For example, riding the bus in Austin is very dangerous. However, it's free for homeless people. So I have a friend who tried to ride the bus, but he forgot his ticket and he wasn't allowed on the bus. However, the bus was full of homeless people. So how is the state currently working towards enforcing these laws in local cities with a lot of rogue bureaucrats that just exacerbate the homelessness problem?
Well, that's a great question, and I'll answer it, and certainly my other colleagues can answer it as well. And that is, look, we at the state level, we work across any number of pieces of legislation to make certain that the things that we do are implemented with fidelity, and that those items are implemented through our agencies, if it's a state agency doing the implementation, or whether or not a county or a municipality or a school district is following through with what we've passed. It's vitally important that the integrity of what we do is always the focus. And so, look, we have issues where there are any number of governmental entities, jurisdictions that don't follow Texas law. And as a result of that, there are penalties. We follow through, we follow up, we push to make certain that there is adherence to the law. There's got to be, we're a nation of where the rule of law matters, and we've got to make certain that every one of the legislative pieces that we've passed into law is in fact being followed through with fidelity. So what I would tell you is that what you just described with regard to that bus situation, I think we have some very thoughtful leaders here in Austin on this topic that are studying and looking at it. I think you just raised a very big issue because you've got people in this community that want public transit, that want to ride it, that don't want to be putting themselves at risk or their family at risk to be able to ride on public transit. I mean, that's the bottom line. We saw it in Charlotte. I mean, again, we saw such horrific manifestations of evil in the last 2 weeks in this country with that poor girl being stabbed on the public transit, on the train in Charlotte, and no one was there to help her. And then, of course, what happened to our friend Charlie Kirk is just unimaginable, the level of evil. But the point being is, I think when the story you just described of your friend trying to take a bus ride right here in Austin and didn't feel safe riding that bus because of the majority of the people on the bus are in fact homeless, the city needs to respond to that and recognize that challenge. And so I think this is where, as Ashley said a moment ago, we are only as good, I'll say this as a lawmaker, I'm only as good as the feedback that I get from each of you, the constituency that I'm blessed to represent. I don't have a monopoly on all the ideas. I want to hear from you. I want to hear these kind of stories because it gives me new insight and new ideas to things that we need to address.
I just want to say a couple of things real quickly. First of all, the story that you cited is classic. It goes on in every single community, and the story is the laws apply to some people but not to other people. And it's really interesting that in the United States Supreme Court case, Grants Pass, the justices really considered this issue of is homelessness a status, or can cities, can municipalities enforce laws based on conduct? And so the question is, do people get to have certain rights and privileges that the other folks in society are unable to have because of their status, homeless, or should their conduct be considered and adjudicated just like everybody else? And so I think what that Supreme Court decision really did was send a signal to municipalities and to states to really understand that there's a difference between status and conduct. We can create laws, we can enforce ordinances based on conduct, and that gives really secure footing so that we actually do have a rule of law, and that some people the law applies to and some don't.
We have time for one more question.
I want to add one thing real quickly, if you don't
Yeah, go
mind.
for it.
What you just described is the reason the president has the executive order that he has. Because in his mind, in our administration's mind, in Secretary Turner's mind, we can have safety and we can also support those that are homeless in our community simultaneously. It's all interconnected. And so that scenario that you just described is ideally what we're focused on within the executive order, again, to have safety as well as support those in our community that need it the most.
But
It's kind of the poster model, isn't it, really, for what the executive order is all about?
for cities that have defunded their police, it's going to be a long road to get back to public order. And in your case, the practical advice here in Austin, because we have 340 less police officers than we need, that would be to have your friend take a picture, forward it to 311. They do respond. So I'm always sending pictures to 311 about homeless encampments and that scenario on the bus. And that signals to the city that we need more law enforcement.
Final question.
And if I may just a comment, with regard to what you just brought up there in terms of lawlessness in the country as a whole coming out of COVID, all the number of cities across the country, and even Texas, that were not enforcing the law with regard to protection of law enforcement. Without law enforcement, there is chaos. And all that defund the police movement was nonsense. And your legislature here in Texas, along with Governor Abbott, stood up and said that any city that continues to defund their police, we will defund you. And so I just share that as an example that Texas is doing everything in our power to make certain that the laws we have in the books are in fact being adhered to.
Hi, Jennifer Mushtaller. I'm a physician. I've worked in psychiatric emergency. I've worked in Travis County or Tarrant County corrections for women. I've also been serving on the Planning Commission. So I have two questions. First, you slid in a very good innuendo, but it's a very important point about holding laws for people who need help. So if you've got somebody brought in for mental health, you can only detain for so long. So that is a barrier to being able to move people into a more surround care situation like you're proposing. And you mentioned it, so I wanted to see if we could have more discussion about potential changes to laws that still respect the individual rights, but help us with the holding and the filing that we need to do that. The second question was on the data, and is there a way to hold cities, for example, like Austin, accountable at the state level for failing to report or respond to the public demand for data and audits?
Well, let me come back and take the second piece first. So yes, I think in terms of being able to hold the cities accountable, we have to do that. Doesn't matter if it's Austin or what city it is. We have to hold them accountable to make certain that the laws are being followed. So with regard to audits, with regard to data, accuracy of data, all of those things, absolutely, every day of the week and twice on Sunday. I think that's very, very important that we do that. With regard to what you asked about the fact that you need to be able to treat these individuals or be able to spend more time with them, and you have such a limited window of time today, given the current law in Texas, that it's a hindrance. It's really asking you to take care of this need in this population. That's the underlying issue, but do it with your arms and your legs tied behind your back. And so what I recognize is the importance of ever so slightly tweaking, if you will, the law to enable that police officer to take someone off the street that could be of endangerment to themselves or to others, and then to extend that time period to 48 or 72 hours, just another day or two, nothing significant in terms of civil rights, but give us more time to be able to really determine, do a medical assessment of whether or not that individual needs a permanent, more intensive environment, or whether or not they're okay and they can be released, as I said earlier, with their hand being held and given to a new nonprofit that can help them to find jobs, the ability to help find additional health care, housing, all those kinds of things that, in my mind, the way I think about it is that the philanthropic community historically has done the majority of that. Texans are the most generous people on the planet Earth. And because of that, because we're so philanthropic, and Americans are the most generous people on the earth, I really fundamentally believe that. That's why I've always believed that a limited government can address all of our needs and challenges as long as you're working and partnering intelligently. Open communication with all of those great ministries and nonprofit sectors. So I think what you're describing is the challenge, and I think what we've been trying to do with this bill that should have passed before June 2nd in the House, but died in the House, and that's a whole other topic for me as to why that happened. We could go on for hours on that, but the point being is that we will get that bill passed. It will be in alignment with the President's executive order, and you'll see Texas lead, working with the administration, Ashley and Secretary Turner and the President, to make certain that I think Texas leads in all things on homelessness like we lead historically on every other issue. Paul?
Two things real quick. I think I really appreciate your question, because this idea of involuntary holds is important. Remember, most of these state laws with respect to involuntary holds, 72-hour holds, they were passed before the crisis of methamphetamine and fentanyl. So the challenge that's happening in emergency departments is that you'll have somebody that co-presents with a serious mental illness, schizoaffective disorder, uncontrolled bipolar disorder. You're a doctor, you know this stuff. So you have these challenges that are also self-medicating with methamphetamine, which is typically laced with fentanyl. So 72 hours doesn't even begin to chip away at what's the underlying cause. Is this person under a psychotic? Is this person psychotic and needs some kind of more restricted environment in order to deal with their psychosis? Or are we dealing with detox? And detox today on methamphetamine and fentanyl is very different than where it was back in the 70s and 80s on cocaine and heroin. I think the solution, and this is one of the things that we're advocating for at the state level, is we need to start looking both in terms of folks who show up at the emergency rooms and need some kind of hold. We need to start extending the time period of those holds based on acuity. And this is the big challenge that we've had on homelessness. We have this thing called the VI SPDAT, which is a very clumsy vulnerability assessment. And I love what you were saying, Ashley, about what we're really dealing with is a healthcare crisis that is born out on the streets and being identified on the streets. When we start actually thinking about acuity, are people able to accomplish activities of daily living? Or is this somebody who maybe a long-term injectable antipsychotic would allow them to continue in permanent supportive housing or a shelter, so that we're able to nuance? I mean, we have so much technology today, and yet we don't use this technology to nuance our decision making. We go from 0 to 100 because, well, this guy seemed to be a real risk. So it's like, no, we can actually take the time and figure this stuff out. We can actually put acuity measurements on stuff so that we actually get the right intervention for the right challenge. And that goes both for the provision of health care on folks who have serious mental illness or serious addictions, and the provision of housing, and whether it's an economic challenge or something else. So I think there's so much opportunity. I'm going to toot my home for a minute here. There's so much opportunity for reform now, where us homelessness policy advocates who used to say things like, you need to do this because it's the right thing. Now we can say, you need to do this because it's the right thing. You need to do this because what we've been doing hasn't been working. You need to do this because the president says so. And you need to do this because if you don't do it because the president says so, you're going to lose money. Those are great incentives. We're talking about incentives. So thank you very much.
Amen. Absolutely. And that brings us to the end of our program. Thank you so much to folks in the audience, folks online, and please join me in thanking the panelists who joined us today.